So any question about pure, so that's how to define meaning. If you ask you what the meaning means purpose, understanding, doing the right thing, and enjoying the results. Meaning always the meaning always lead to enjoyment. All the studies on meaning, they always happiness is always one component. You study happiness, meaning always one component. These are together, linked, two sides of the same coin. If you do something meaningful in your life, you always feel good about yourself. Okay, next slide. Now, here is a tool, powerful tool. Okay. Now, do you know about Albert Ellis ABCDE? Eh? This is my ABCDE. Now, what's wrong with Albert Ellis ABCDE? He can't define himself. It's too bad. But there are many people practicing that, right? So I'm just saying, I went to Hong Kong to speak to group psychologists. So many of them practice cognitive behavior therapy. Okay, most of them do. So they come around, they agree with my critique. Okay, but most of them agree with me. Okay, but what's wrong with cognitive behavior therapy is ABCD?
There's no meaning in it.
Huh?
There's no meaning in it.
Sure, there's meaning. Because they're reframing the meaning, right? The whole idea, reframing the meaning of event, right? Okay, let me tell you what I think is wrong, okay? And you can challenge me. So Albert Ellis tried to reduce everything to irrational thinking, right? So if you have depression, anxiety, it can, so A means something happened, antecedent condition. B means belief, usually irrational belief. C means consequence, okay? D means you dispute, you have to dispute your belief, okay? And E, I forgot what E is. What's E is? What's E? Huh?
Energy.
Then you have energy, right? Energy. Okay.
It's missing one letter, which is the I.
Huh?
It's missing the I.
I didn't get you.
The identity.
Oh, my identity. Okay. Oh. So, come back to that. Okay. You know what's wrong? I talked to a very famous psychologist in Hong Kong. Okay, and she might know him. Okay. So he wrote a book on cognitive behavior. A self-help book, a popular book in Hong Kong. Okay, how to help you, how to improve your life with cognitive behavior therapy. Okay, like Albert Ellis has a popular book called "Rational Guide to a Practical Guide to Rational Living." Okay. He agreed with my analysis. I said, often people have problems. But people are complex. It's due to many problems. It's not due to cognition, right? Not just due to thinking. Maybe there's many things are missing in their lives. The basic needs are not met. So you cannot just blame the victim. Say, oh, your thinking is all screwed up. You can think of the rational, but you're still miserable because the basic needs are not met. His wife walked away, has no wife. His boss fired him, he had no job. He had no money. Everything negative. So it's more than just his thinking. His living circumstances so negative. Okay? So now I came along and said, look, I don't care how how bad your circumstances. It cannot be worse than the death, nasty death camp that Franco gone through. I don't care how much suffering you have. But this ABCD can help you. Why? The first one is A, acceptance. I'm a cancer patient. I'm broke. I'm a failure. My wife dumped me. I'm stupid. My boss fired me. I'm no good. I'm lousy. Okay, so I meet you where you are. It doesn't matter how bad you are. Okay, that's fine. It's fine. It's okay. It's fine to be lousy. Okay, it's fine. You accept yourself. But that's the turning point. I'm in addiction research. It's called rock bottom phenomena. Often drug addicts have to hit the rock bottom before they change. They always think they're fine until they hit rock bottom. So the rock bottom experience is an opportunity for positive change, for growth. A crisis, a trauma, open up opportunities for positive change. But there won't be any change until there's acceptance. Or you become denying your problem. You keep avoiding talk about your problem. Oh, I'm not dying. Don't talk about it. I'm not dying. Oh, I'm not an alcoholic. I just like drinking a little bit much. I don't have a problem. How many clients refuse therapy because they think they don't have a problem? The one day a chef, he co-owner of a restaurant, he's so fussy, so bad temper, and sometimes, when he's so temper, the restaurant has to shut down. So the manager, boss, got so desperate, want to pay for therapy, bring him to see me. Okay, here my chef. He's so fussy, so demanding. Nobody can work with him, and he's so bad temper, and he's scared. But this chef say, I don't have a problem. I don't have a problem. I know that I'm a little bit fussy, demanding, but I want to produce the best quality of food, right? So they refuse the therapy. If people refuse to accept their problem, they can never get better. Self-improvement begins with self-acceptance of your weaknesses. Right? You will want to improve your strengths? Okay. You accept that you need improvement. Right? You accept improvement. But if you only accept with the other part, you'll be depressed, right? Oh, I'm no good. I'm a bad person. I'm cursed by God. I'm punished by God. Nobody loves me. I'm going to eat worms. Nobody wants me. You'll be depressed, right? The second part is come from Franco. Franco said, it doesn't matter how rotten your life, how miserable life, life is worth living. You can always discover hope and meaning in every situation right up to the last breath of your life. Now that's faith. Well, there's no scientific proof that. But that's useful faith. Faith gives you hope when everything fails you. When everything fails you, the world fails you, your friend fails you, everyone fails you, you still have to believe there's something worth fighting for. There's something worth living for. There's something worth believing for in. There is meaning to be found in the most unlikely situation. You can get this idea across. I went to hospital ward, okay? People are paralyzed Useless. And then people bring me to another world with senile people who are dementia. And the nurses say, well, what do with those patients? What the use of taking care of the people? I say, do you think those people are not worth living? Do you know that they might have consciousness, that they're thinking people, their feelings? Do you realize that when you touch them, they can experience the connection? Maybe the connection is what keeps them going. Maybe you whisper to them, talk to them. Oh, the people care for me. That makes my life worth living. That's meaning. That would come back to your mother, right? The fact you care for her. You have no idea what it means to her. She would rather endure the pain to be able to see it, to be with this dear daughter. She doesn't want to die. Maybe she doesn't want to be a burden. But deep down, the connection between you and your mother is beautiful. That gives her, that's a source of joy, right? Some sort of meaning, relationship and intimacy. If there's an intimate relationship between you and your mother, that is sort of immense joy for her, satisfaction, even though she has lost most of the functions. So that belief is a turning point. So this is another turning point, right? Accepting is a turn around. Belief get you on the right direction going. Now, if you believe there's the life of meaning, that there's something good worth living for, then let's action. Action speak louder than words. Then what do you do about your life now? Let's, that part of, I think the part of psychology exercise, also including goal setting, right? Goal setting. So what kind of change you want to make? What goal do you want to achieve? Let's set some goals, right? Commitment to worthy goals and responsible action. So then you start, you may try to say 1,000 miles begin with one step, right? You start the first step of change. Now, what will you do differently? What will you do differently now that you believe they can change? Let's make a contract. Let me make a contract, okay? This week, give me a realistic goal. What kind of goal, what kind of behavior you want to change? It can be a tiny little bit, small victories, okay? Give a concrete goal, let's make a contract, okay? If you achieve that goal, I'll reinforce you, okay? I'll give you a star. Reinforcement, okay? I give you a star, okay? I give you a token money, okay? You collect that for buy something, whatever, okay? Commitment, reinforcement. Once they start taking the concrete step, now, it doesn't mean that you will not, relapse. And everybody in addiction knows the relapse. Doesn't matter. Don't let relapse get you down. Get back again. Continue the thing. Continue the action of change, right? So that is, so you try to make the goal intrinsic. The tons of research show, what do you want to change? Intrinsic motivation that I want to make changes for myself. I want to be a better person. I want to make changes because my wife wants me. Oh, that's extrinsic. It doesn't work very well. Right? Extrinsic never works as well as intrinsic. Ryan Deci has documented many studies about that, okay? Not this Ryan, the other Ryan, okay? Intrinsic motivation is always more powerful. You want to change because you want to be a better person. You want to change because you're sick and tired of the old way of life. Not because the core mandate you to go to therapy. That's external. Or because you your wife forced you to see sex therapy. Otherwise, she will divorce you. That's extrinsic. So we want to help people to make a commitment goal that based on intrinsic motivation. Got that? Now, when you do ABC, you will discover a new world open up to you, right? A new world begin to open up to you. Before you got stuck in a corner. You got stuck there. And now you turn. Move forward. And as you move forward, the new world begins to open up. You discover more about yourself. More positive things about yourself. You discover more about the world you did not know before. The world is actually more beautiful than I thought. You might discover that your spouse might be a better wife, better husband than you thought she was. So discover things you never knew before. Right? And then you enjoy the success. Now, on the other hand, again, evaluation thing. If it didn't work, you go back. You get to reaffirm your belief and commit to a just goal. You remember, I've done a lot of research showing that if one doesn't work, you try new things. You try new things, still doesn't work, you need to change your goal. Searching your goal until you're able to get it going. So with ABCD, you can overcome any trauma, any crisis, any obstacle. You would go through this, okay? So life go better with what? Life go better with pure, right? I can overcome better with ABCDE. And I can go anywhere with two wheels. One is focused on the positive and negative. The other thing, ABC primarily negative. See, the first one means positive, primarily positive. The second one, ABCD, is both negative and positive. It's a way of transforming negative to positive. It's not say avoiding negative or minimize negative. It's a way, your way of thinking is that how to make the most of the negative, right? How can I squeeze more life, more joy from the negative? How do I turn negative into a positive energy? Negative can be a positive source for motivation. The best revenge is success, right? The best revenge is success. It really motivates you to on a path of success and happiness and positive change. And my youngest brother, my second youngest brother, he's the worst student in my family. We have some brothers, right? They're all good students. This guy, never grade 5 education. He's fat, he's sloppy, And my father said, "You're useless." Every day the negative message, "You're useless. I can never depend on you. You're useless." And then just to prove my father's point, he ended up in jail. He was working he did something silly. He ended up in jail. Go down. But after he get out of jail, he's a completely different person. All the negative things in his life, enough is enough. I'm going to be a different person. Like in prison, he read so many self-help books, psychology books. He came out a completely different person. Now he's one of the most successful insurance executive in Hong Kong. He has he has 2 books published. He has episode, 60th episode TV on his life, and then the feature film come out about his life. You know, when my father get old, he the only one support my father. All negative experiences really make him crazy. All the pains that I endure make me determined to be successful. And you know, he's selling insurance. He work 12-hour a day. He go anywhere, you know. So he started winning awards, you know, competition, you know. He climbed higher and higher, higher. He got about over 3,000 people working under him. He make a few $1 million a year, just sitting there. And he took to get bored. He started a change seminar, how to help people to change. Every weekend, 100 people listen to the seminar. They make another few $1 million every time people come to the seminar. Then thanks to all the beating he had taken. So negative is not all bad, okay? So ABCD is my gift to you. ABCD, okay? I am pure. And what time is now? Oh, next slide. Huh? Oh, I'm sorry. Oh, sorry. Okay, I'm sorry. But that's my gift for you, okay? Pure and ABCD. And double vision. I often forget my time, you know.